I wonder if SmartPak in general, not specifically Ask the Vet, could do a full 101 video. For example, when to do what, i.e. vaccinations, farrier work, and wellness on a foal. This also, of course, got a lot of questions and comments.
We don't even need to be here.
Anytime you mention foals, it's always going to bring in a lot of comments. So from Breakfast Foods, which also fantastic name.
I love that.
I've been interested in becoming a vet, so I've always loved to learn new information about foals.
Oh.
And then Lauren said, I just want to see cute babies. Lauren,
baby horses, especially like miniature baby horses, baby donkeys. Maybe the videographer will put a baby donkey picture in.
Oh, I think we could find a baby donkey photo. But anything about baby foals, I agree with, and I agree that we should absolutely do a Foals 101 video.
Okay, all right.
And
so this will be our start, and we'll kind of gather up the information from this and then move on. So
I was kind of hoping there was going to be a foal waiting in here when we came in today.
Oh, sorry, so sorry. So Foals 101, gosh, this is a huge, huge topic, and might take more than one video. So I put everything together, and I'm trying to condense it down to what we can cover in 3 minutes here. I think of foals as sort of before they're on the ground, so mare care, and then the first 30 days or so of the foal's life, up to weaning, and then life of the weanling.
Okay.
You know, so those discrete segments all have special veterinary medical or preventive wellness care needs and nutrition and everything. So I guess the first piece of advice is, or what I would include in a Foal 101 video is, make sure your mare care is up to date. So that includes vaccinations and deworming, because the mare's health influences the foal's health. That first milk, the colostrum, the what the scientists or the veterinarian would say, the passive transfer of maternal immunity or immunoglobulins is really important, and that comes from having your mare vaccinated against common diseases early.
Okay, so make sure mother is in good health.
And that she's at a good weight. I mean, if she's thin or fat, then she's either not going to make a healthy baby or be able to feed a healthy baby or have foal out well.
Yeah.
So you want to have a good a 5-ish body condition score. And I'll say this so I don't forget it, is if you're breeding a mare or you've got a young horse, you've got to have your veterinarian involved. There are so many pieces of parts. Like, for example, when the mare foals, the veterinarian needs to come out within the first 12 to 24 hours and do a wellness foal care, whether you see a problem or not. The vet needs to evaluate that foal for, did he or she stand up? Is the nursing going on? Is the cognition all there? Is there a heart murmur? Do the eyes look good? Is there a patent urachus, umbilical? I mean, there's so many things to look at. You need an expert who can quickly do a physical exam and make sure that everything is okay. As an owner, your job is to, make sure the foal has, and continues to have, because things change quickly, straight legs. They're standing completely on their hoof. They're nursing, they're sleeping, they're running. They're doing all good baby horse things or baby donkey things. There's so many things that can go wrong that if your foal is not doing those things, then contact your vet. And obviously, this is like the last topic, behavior. You need to do a lot of reading if you're going to have a, breed a mare, have a foal, have a young horse, because there's a lot to know. I don't want to get into specifics as far as when you should do what, but I did read on a farrier's website that I trust. He likes to be out there looking at horse feet and legs and trimming on them at the first month, so 30 days. And he likes to come every 30 days.
Okay.
To make sure that things are progressing correctly, because there could be, angular limb deformities, flexural limb deformities, contracted tendons, that if they're handled early, you can, if you're on top of them, you can make them the horse can end up having a useful, productive life and be healthy and sound without surgical intervention.
So the farrier likes to come out early to do any foundational work on the feet that could be impacting any of the
and examine them. This farrier said, I like to watch the foal walk and make sure they're landing heel to toe and the legs carrying straight and there's nothing funky going on. So this guy stays on top of it. She asked, I think, about vaccinations and deworming. There are protocols. Your veterinarian will help you develop the protocol that is right for you, because it differs. Was the mare vaccinated ahead of time or not. That's a huge difference. Where you live geographically, the foal's risk of exposure to certain diseases, the type and brand of vaccine you use, it's all that depends on what vaccines are given when and which intervals. Because with foals, or the first time a horse gets a vaccine, you don't give just one. One's a booster. We have to start the series of 1, 2, or 3.
Okay.
Yeah. So, and nutrition, it's important to feed the foal right early. When to begin creep feeding, what do you creep feed with? Having the foal's body condition score of 5 is important because they get too heavy or they get too much sugar in their diet, and then you run into developmental orthopedic disease and other problems. Boy, there's a lot of stuff.
There's a lot.
There's a lot. There's a lot.
So a lot of it sounds like one, your own horse's condition, the mare's condition, then the foal's condition.
Yep.
When it's born, if there's any sort of deformities or things that have to be addressed.
No
then.
normal.
Yep.
And then when to call the vet for abnormal, but your veterinarian will need also to make assessments. We don't wait that first 12 to 24 hours. You get the vet out and make sure things are okay, because things might look good to you that are not on track, and you want to jump on them early.
Okay. And especially, so work with your vet closely for finding out all those other vaccinations and things of that nature, depending on your area and your horse's health. So, well, if you guys have any other questions about foals, and make sure to send them our way. And if you have any photos, please send them. You can send them directly to me. It's okay. What?
Baby donkeys.
Oh, and baby donkeys. We're into all of that. And I will definitely get working on that Foals 101 for you.